we become more effective influencers? How do you influence people to do things they don't want to do? Today I'm going to give you some quick takeaways for how we can be more effective influencers and learn from some of the best at influence who face some very tough challenges. So I want to start with a tough challenge: teenagers. A very resistant, rebellious audience, particularly when you ask them to do something they don't want to do. One of the most effective influence strategies I saw with teenagers was by a janitor at a high school. And what he did is he started to notice something. Every day, at the end of the day, he would notice on the mirrors at the school, there would be these lipstick blots all over the mirrors. Because what the girls were doing in this high school is they were thickening up their lipstick, and then they were blotting their lips on the mirror, causing the janitor a headache every day. Because the water he was using to clean the mirrors weren't cutting it, and he'd have to scrub, and it was taking him more time, and it was keeping him from other duties. So he went to the principal and he said, "You got to do something about this. Can you talk to these girls? Can you say something? Can you do something?" The principal says, "Sure, I'll take care of it." So the principal gets on the PA system, the loudspeaker, and he says, "Girls, we noticed that there's a problem. Please don't blot your lipstick on the mirrors." What do you think happens? More people do it. The people who weren't doing it before said, "Oh, that's kind of clever. I'm going to start doing that." And so they're starting blotting their lips and kissing the mirror, causing the janitor even more headaches. So he decided to take things into his own hands. And so he got the 10 most popular girls and he rounded them up and he says, "Come with me here into the bathroom because I want to show you what I face at the end of every day." He says, "Look, I want you to see this mirror. I want you to see all these lipstick prints that are on here." And the girls are self-consciously kind of looking down and snickering because they know they're the ones that are doing it. He says, "I need you to help this to stop. Can you tell your friends to stop doing this?" He says, "I want you to see what I have to do to get this off every day." So he takes the squeegee and he goes over to the toilet and he swishes the squeegee around the toilet and then he brings it over to the mirror and he scrubs and scrubs and scrubs. Nobody kissed that mirror after that moment. What did he do? Well, he connected their bad behavior to some natural consequences that were happening, but they just weren't aware of. And he was also using some peer pressure. Since they were the most popular girls, that message spread like wildfire through that school, and it stopped immediately. Well, if that janitor can be that effective with rebellious teenagers, what could you do with more influence? What changes would you make in your own lives? Maybe you'd eat better, lose some weight, be more effective with your own teenagers? What impact could you have in the workplace if you had more influence? Perhaps you could get the loud talker in the cube next to you to quiet their voice. Perhaps you could get your team to hit their deadlines and meet budget. What would you do if you had more influence in your community? Perhaps you could finally have a homeowners association meeting that doesn't devolve into a shouting match. What could you do with more influence? I wanted to start with a story about a janitor having influence because this skill, influence, is not reserved just for the heads of our organizations. It's not just for the person at the corner office. This is something that we can all access and can make big changes with, make big impacts, make a big difference. I want to have us learn from some people who've done just that and have faced some tough challenges and been very successful at facing very challenging issues. And our first influencer that we're going to talk about, and I'm just going to give you a little teaser into each one, is Silbert. She was the founder and president of Delancey Street Foundation, and her challenge is to get repeat felons and drug abusers, particularly lifetime drug abusers, through their own efforts to turn their lives around. Now, that's particularly a challenging issue when you think that 2 out of every 3 felons is rearrested within 3 years. Pretty tough challenge there. She does this by a variety of businesses and a residential program, and I'm going to talk to you a little bit later as we move forward. What did she do to be able to influence here, and how successful was she? The other influencer that we're going to talk about is Howard Markman, and he is the co-director of the Center for Marital and Family Studies at University of Denver. And he is taking on the challenge of helping people maintain their relationships. How do you get people who are unhappy in relationships to enjoy each other's company, to have stable relationships so they don't get divorced? A tough challenge that he took on, and we'll see how effective he was with his influence strategy. The last influencer I'd like you to meet is Dr. Wiwat Rajanapathyakorn. Say that 3 times fast. He calls himself Dr. Wiwat, and so will I. He worked for the Thai Ministry of Public Health, and his challenge was to stop the rampant spread of HIV in Thailand. Back in the 90s, the numbers were increasing at an alarming rate, and Thailand was slated to be one of the countries with the top AIDS rate in the world. But that never happened, largely in part to Dr. Wiwat's influence strategy. Well, what did they do? What did these influencers do? Well, one of the things that they all have in common is they focused on behaviors. Behaviors that drive results. They're universally firm on this point. Before they figure out their influence strategy, they have to figure out what they're going to change. What do we want to change? But what we often do is we think about results or outcomes or what we want to achieve, and we miss the behaviors, which are going to drive those results. Dr. Wiwat faced this when he first went into his big challenge of stopping AIDS in Thailand. His training told him, well, this is an education problem. People need more information. His advisors, who'd been working on the problem for many years unsuccessfully, said, yes, people need more education. But he realized people need to know what to do differently. We need to focus on changing behaviors rather than just giving them information where they may or may not do anything differently. How can you focus on behaviors? We make the same mistake when we're thinking about our own influence strategies. Take weight loss, for example. We say, oh, I want to lose some weight. You might even say, I'd like to burn more calories than I consume. But that's what you want to have happen. How are you going to make that happen? What are you going to do differently every day to achieve that goal? And it happens in the workplace. We say, oh, we just need to launch a new product line and that's going to solve all of our problems, rather than focusing on behaviors. Or we need to bring in a new leadership team. Or we need to restructure our building, rather than behaviors. And by behaviors, I mean things like, and of course this would vary on the challenge that you're facing, but things like, are people speaking up when they see project plans developed that are not based in reality? Are we starting our meetings on time? Those are behaviors. Now, what are we doing? What are you doing? What kind of a behavior can you focus on? Well, this is the first takeaway. When you're thinking about your influence strategy, how can you think about behaviors that are going to drive results, and that will make you a more effective influencer? So now we have this first takeaway. Let's take it to the next level. What the best at influence do is they focus on vital behaviors. What are 2 or 3 key behaviors that are going to have a disproportionate impact on your success? What's going to have the most leverage to get what you want to achieve accomplished? So Mimi Silbert, the woman who was in charge of Delancey Street with the felons and the drug addicts, she was faced with this challenge because she said there's lots of behaviors that we've got to address here. But she knew that if she addressed 20 behaviors, as soon as someone walked in the door, she would have no impact. Her strategy would be diluted and lost. So she said there was, something that most felons struggled with when they came in the door, and that was the code of the street. When they came in, there was 2 rules of the street, and that was you look out just for yourself and you don't rat on anybody. And what Mimi discovered after trial and error of many different behaviors, if you can reverse those 2 behaviors, you can change almost anything else. And so when anyone comes into her community, she immediately makes them responsible for someone else's success. So after a week of being there, you already have somebody underneath you where you teach them a trade. You might teach them something basic like setting a table at the restaurant. And then people, instead of asking, how are you doing, they ask you how your crew's doing, because you're responsible for these other people's success. She also demands that people speak up directly to each other if they encounter any broken rules, aggressive behavior, speaking up when there are any problems. Those 2 behaviors make a huge impact on Mimi Silbert's influence strategy. Take a look at Dr. Wiwat, trying to battle AIDS in Thailand. Lots of different strategies he could use, lots of different behaviors he could focus on, but he found a statistic. The statistic said that 97% of HIV was transmitted through heterosexual contact with sex workers. So he realized that if he focused his behaviors on getting sex workers to use condoms, that would make a huge impact in his strategy. Huge impact on getting those results that he wanted to achieve. And finally, Dr. Markman, trying to work on people wanting to maintain relationships, looked at all different behaviors. And what he said, it's not about how many interests people share and what their family backgrounds are like or how people were raised. He said it comes down to how people argue when there's a disagreement. And if people start that conversation with disrespect and cutting remarks and not listening to one another, withdrawing, the outlook looks grim. But if they can start a conversation with mutual purpose, try to show respect in how they communicate, that shows a promising future. That vital behavior, how you argue, how you talk, how you communicate when there's a disagreement, makes a huge impact on your results. So, second takeaway is focus on vital behaviors. Now, one question that comes up is, well, how do I find vital behaviors? Because I'm just sitting at my desk and I don't have the resources to do a big study, and how do I know what the vital behaviors are? Well, you can do some trial and error, some testing to see. It might not work on the first try. Many of these influencers tried many different strategies first before they got to the one that worked best. Another thing you can do is, if it's a common problem, there's likely already been research done about that issue, that particular influence challenge, and what are some vital behaviors. Take weight loss, for example. The Weight Loss Council has determined, they've studied over the years, what sets the best at losing weight apart from the rest. And their data shows that people who've lost 30 pounds or more and kept it off for 6 years or more have 3 behaviors in common. Get out your pens, here it comes. They exercise on home equipment, they weigh themselves daily, and they eat breakfast every morning. 3 vital behaviors that have a disproportionate amount of impact on their success in weight loss. So you can look and see what research is out there to see what might a vital behavior be. Finally, the other thing you could do if you're not sure what a vital behavior might be is to see where other people are succeeding, where you're failing. So who is able to raise really obedient or effective, confident teenagers? Who's doing a great job with that, has a great relationship with their teenagers? What are they doing differently? What behaviors are they doing? Who's able to meet their deadlines at work when I'm not? What are they doing differently? There was a hospital that got very low rankings on their customer service satisfaction surveys that they would get every year. And they said, what are other hospitals doing? What can we do differently? What can we learn from other people? What are these vital behaviors? Because there's so many things we could do. Where do we want to focus our efforts? So they sent out 2 teams, and they said, go observe the best, find the people who get the highest rankings on their surveys, the individuals. Observe them, find out what do they do. So the teams went out and they found people at different hospitals, at their own hospital. They went on the web. They made phone calls. And what they found were 5 vital behaviors that would have a big impact on their customer service results. And that was smile. When you encounter a customer, smile, give them eye contact, introduce yourself, tell them what you're doing and why, and in the conversation with, is there anything else that you need? Those 5 behaviors drove their results. So again, another takeaway, if you can't find your own vital behaviors, you don't know where to start, look and see if it's already out there. Conduct your own research or find where someone else is doing it well, where you're not succeeding, and learn from them. You know, when you can do these things in influencer, there's so much more. I just have a little bit of time today to talk about it. The powerful results you can have are so inspiring. I just want to show you what some of these influencers have been able to do. Mimi Silbert, her success is that 90% of her graduates never return to drugs or crime. She's had 14,000 people come through Delancey Street with very incredibly low rates of return to crime. And with not a penny of government funding, with no licensed therapists on staff, with no counselors, it's self-supported by these people. Very impressive. Howard Markman developed a training based on those vital behaviors. Those attending his training, focusing on how you communicate with your significant other, are able to reduce the chances of divorce by 30%. And finally, Dr. Wiewat He helped cut new HIV infections by 80%. And the Thai government has estimated that there are 5 million people that otherwise would have been infected with the AIDS virus that are healthy today. What could you do with more influence? What impact could you make? Again, these are strategies that are accessible to all of us. I just want you to dream for a little bit. What impact could you make? You just start out by thinking, what are some vital behaviors I want to focus on? Make sure you're focusing on behaviors and not outcomes. Get creative, have fun with it, and the difference you can make may even astound you. Good luck on your influence strategies. Get out there and go influence. Thank you.